and American healthcare, like it's really kind of, it really got very little attention during the election, but it's so fucking terrible. It's incredibly expensive, and the quality of the care, especially for people, below the median income, is atrocious. Like the majority, I was just reading an article about this in the New York Times. Majority of rural hospitals in the United States now have no labor and delivery units. So, we're paying something like $10,000 per capita for a healthcare system where, something like a third of the population does not have a local hospital where you can deliver a baby. And Insane. It's like, can it be any surprise that one of those people goes apeshit for whatever reason? And even if it wasn't the reason that we suspected is that so many people would react to it in this way. And, I think it's sort of like I'm reminded of the Russian Empire in the 19th century and the early 20th century, where you, the system was shitty, and you had this sort of push and pull between the reformers and the Romanovs and the sort of hardliner authoritarian autocrats who were like, no, we just need to kill people until they shut up. And that ended up in the First World War with the most stupid of the Romanovs, Nicholas II, saying, no, we'll just kill enough people. And it ended up destroying the entire country. That's sort of where I land, where it's like, yeah, don't shoot people. But if you don't want people to be shot, you need to create a system where that's not a sort of like, you're not mass producing the type of people that could think that.
Vigilante justice is not the way forward, but it certainly is a reminder of the extent of injustice that needs redress, and maybe the paucity of the politics that are sincere, because you have, Trump blustering with all his reactionary promises, but he is like the only one that seems to be really being bold and calling for dramatic change, right? And so we've long talked about this need to have a kind of, democratic socialist or social democratic vision and powerful politics that calls for and promises real transformation, not, Joe Biden's nothing will fundamentally change, or, the evidence that came out that Kamala Harris was dissuaded from continuing any populist messages and trying to kind of just couch everything in wonk speak and pretending that the status quo is something that satisfies most people. I don't know what else it'll take for people to demand and for politicians to listen to the need for gutsy, risky proposals that it's insane that healthcare wasn't discussed, right? And it's not going to come from the right. It has to come from the left.
To the point of, this being a sort of post, truth moment, the Donald Trump's administration in waiting of Elon Musk and Vivek Ramaswamy and RFK Jr., their proposal is to cut the shit out of Social Security, Medicare, and Medicaid, and the Veterans Administration. Previously, the third rail of politics. Several third rails of politics. Nobody would touch the VA before. Everyone loves the troops.
Yeah, this idea that the source of people's problems is in like government bloat rather than in the corporate domination of the demos and the subservience of the people to the market. It's just such like a self-own to let that narrative have any purchase. It's embarrassing.
It's very obnoxious because there is a tremendous amount of bloat in the government. And the reason there is because we cut in the private insurance companies like United Healthcare.
the middlemen who get paid for doing nothing.
Yeah, they get paid for ripping off the government. You know,
That's right.
Like we have this program called Medicare Advantage, and it is, if not now, soon will cover the majority of Medicare enrollees. And it's basically you're paying private companies to administer Medicare benefits. And so, the thinking is, well, okay, we have to take some steps to make sure they aren't ripping off the government. And so the CMS, Center for Medicare and Medicaid Services, maintains this database of every single Medicare enrollee. And so it's like 65 million people. And they have an individual risk score. There's just like thousands of bureaucrats laboring in the trenches of the federal government to figure out, how to determine this. And yet the private companies who administer this program, which I believe includes United Health, are constantly ripping off the government by jigging the metrics. They pay doctors to upcode their diagnoses of patients who are not sick, but they can appear to be sick so that they get more payments from Medicare. And, it's just this termitic
scammy stuff.
Yeah, the infestation of the private profit motive into every aspect. And it was like deliberately welcomed into this fundamentally.
Just like the student loan servicers, which there's no reason that government loans should ever have involved private companies servicing the loans. And
it was just a compulsive. It was like, we can't do this ourselves. We have to get private. We got to get, we got it. We got to have private. We got to have private. We got to have private service. We get private. And it ends up being more expensive than it would be. That if you could literally, and in many other countries, they do that. You just hire the same people, come work for the government to do the same job that you have now.
That's right.
And you don't have the bad incentive to rip off the state. That's the end of the preview, folks. As usual, we like to mention that this podcast is sponsored by the American Prospect Magazine. So if you want to listen to the whole thing, you can subscribe at $5 a month. If you want that plus a free subscription to the website, plus the opportunity for a steeply discounted print subscription, you can do that if you so wish at $10 a month. And otherwise, thanks for listening. We'll see you next time.